blunt probe. Oh yeah, we could record it. If you take your blunt probe and we start in the left ventricle, which is down here, when the blood pumps out, we're going to pass through the aorta, right, to get to the body. And we have a few branches that will come off of the aorta. We see one branch here. Remember, we go up to the head as brachiocephalic, or as common carotid. We go to the arm as brachiocephalic and up to the head as well. And then we go to the left arm, first as subclavian and then as axillary and brachial. What you see across the front of the heart here, which is usually my landmark as to whether I have the anterior or the posterior side, is your pulmonary artery. So artery away, and we're in the pulmonary circuit, means that I must have been pumped from the left side of the heart, or sorry, the right side of the heart, in order to get blood over to the lungs. So that means I should be coming from the right ventricle. So if I go backwards, I've put, again, my probe through this very most anterior big vessel, the pulmonary artery. So I should come out in a ventricle, right? Because I'm pumping from my ventricle on the right side of the heart to the lungs. And so here I am, look, my probe is up in the ventricle. And if I closed my heart, that would be on the side that I would expect it to be on, right? The right side. So I know that this is pulmonary artery and that these are branches of the aorta, because the aorta, when I go backwards, goes into left ventricle, whereas pulmonary artery, when I go backwards, come on, comes out in, I'm getting stuck on the valve, comes out on the right side, right ventricle. Okay, so again we said we have valves in between the atria and the ventricles. So let's see if we can find superior vena cava. There's a very large, very, very large vessel here at the top, right next to the atria on the right side. So that should be then superior vena cava, and when I insert the probe inside, I should end up, if it's the superior vena cava, I should end up in the right atria, and there I am. So through the right atria then, we've collected blood from the top of the head through superior vena cava. They did not leave the branch for inferior vena cava in. This is where both are going to merge and enter the heart. This little guy in between the right atria and the right ventricle is your tricuspid valve. So these little flaps are made up of the lining of the heart wall called the endocardium. This is also that structure that keeps the electrical impulse from passing the atria and heading straight to the ventricles. Right? We have this kind of fibrous system making a barrier across for both electrical signals and to prevent backflow of blood. So this is part of your tricuspid valve. You have these little threads here, your heartstrings. We call these chordae tendineae, and they're anchored by little papillary muscles. So when the ventricles contract, the blood pushes up on these valves and it closes them. So that the only way to leave the ventricle on the right side is to go out through the pulmonary artery. So we go from right atria through tricuspid to right ventricle, and we leave the pulmonary artery. We go to the lungs, drop off carbon dioxide, pick up oxygen. Now, if I properly find the pulmonary vein, where should I end up when I come back to the heart? I should come back at the left atria. So I'm not sure looks like they've cut off where all of the pulmonary veins would enter, so we just have one great big opening here. So all of those pulmonary veins are merging, like you said, on the left atria, bringing the blood that is oxygen-rich to the left side. So we go left atria through the bicuspid or mitral valve. And so again, you can see chordae tendineae. You can see the flaps of endocardium making up the bicuspid valve. We go from the left atria to the left ventricle, out the left ventricle through aorta. And aorta serves the rest of the body. We also have valves leaving the ventricles as we enter those great vessels. I'm trying to see if I can find, they look like little cups. Here's one here. So here's your aortic semilunar valve. Look, it looks like a little cup. See how the probe is in the cup-shaped structure? So this keeps blood from flowing backwards by filling the little cups, and the cups close. Again, this is all endocardium. So we have aortic semilunar valves, and in the pulmonary trunk, we have pulmonary semilunar valves. So in your heart model, it'll be a lot easier to see some of those valves. Here, I'll try to push through and show you. Maybe if I zoom in. Let's see if it just focus. There we go. Okay, so I'm trying to come through backwards. I should get stuck in a little cup, in a little valve. Let's see if I can. So can you see I hooked? Okay, see how my little probe now is caught in a little flap of endocardium there? So I came through the pulmonary semilunar. My probe is stuck on that pulmonary semilunar valve. And so that's what the blood should do. It should fill up that little cup. There's like 3 of them, and it closes all 3 so that the blood doesn't go backwards into the ventricle.